Thursday Thought Leaders with Harbinder Narula. It was during the pandemic that people realized that either they were not insured or they were not adequately insured. They understood the importance of protecting themselves for any uncertainties. Insurance has been a really big sector, and just like financial sector, banking, it is having access to a lot of data. Processing this data is extremely important. To discuss the insurance sector, the role of TPA, and to understand how technology is making a difference in this particular sector, I have with me a special guest, Mr. Satish Gidugu, who is the whole-time director and the CEO of one of India's largest TPAs called MediAssist. Satish has been an engineer at heart, served as engineer in SAP, served as a CTO at Redbus, but then took on to MediAssist and today leads its business as the CEO. Welcome Satish to BW Healthcare World and Thursday Thought Leaders with Harbinder Narula.
Thank you so much, Harbinder. It's such a pleasure to be part of this.
Satish, before we get into the conversation, for our viewers, I'd love to understand what does TPA mean? What do they do?
No, thank you so much. Maybe just take a step back, and I think we call ourselves a benefits administrator as a group. And of course, in India today, healthcare benefits are predominantly led by the insurance players, right? Benefits are backed by insurance. And in India, unlike across the globe, the general insurers lead the health insurance market, the indemnity market, right? Worldwide, it is usually the life insurers. And the insurance companies are responsible for underwriting risk, issuing healthcare policies that cover a set of benefits and mostly indemnity policies. We are an intermediary as a TPA in India, licensed by the IRDAI as a third-party administrator with the mandate to take care of all the servicing aspects of the healthcare policies, right? We do not sell, we do not distribute, we do not advise. We are simply the extended arms of the insurance companies responsible for the end-to-end service delivery, right? For example, enabling a cashless network and hospitalization, or processing claims, managing data, call center support, fraud, waste and abuse identification, prevention, all the entire gamut of the servicing aspects of healthcare. So that's what we do as part of our India TPA business, and which is a significant part of how our group operates today.
Awesome. And Satish, personally, I mean, you, like I said, you've been an engineer at heart, then you took on the role of a CTO when you were building Redbus. How did MediAssist happen to you, and how did it transform to a business side in your career?
Well, it's an interesting, I guess, destiny. I spent my first 15 years as a technologist, been part of 2 startups that saw an exit in the country. One very early on, a product-based company that SAP acquired back in 2007. That brought me to SAP. And then with Redbus as a CTO. So after Redbus got acquired in 2013, I wanted to do something slightly different rather than continue back in e-commerce. Then I just got introduced to MediAssist at that point in time through a common friend. I met Dr. Vikram, who's the promoter and still the current chairman of MediAssist. Those were the days when I was moving from Redbus, and we were a tech company, internet startup, cloud, and so on. And here was MediAssist in the healthcare space, where we were still dealing with fax. The hospitals used to fax discharge documents to us. Right. Those days, and it's not too long ago, just 10 years ago. And then as I spent a little bit of time understanding the space, it seemed like the healthcare providers were investing in technology inside, in caring for the patient, but not as much in dealing with the patients and the experiences. And insurance always was not great in technology, in investments, and that the combination of healthcare and insurance seemed like the worst of the places, right, for health, technology. And it seemed like there was a lot that we could do by bringing tech into that intersection of healthcare and insurance. So that's when I sort of took on the role as a CTO. But I've always been someone who wanted to use tech to solve a business problem, not to solve tech to solve a tech problem, right? There are two kinds of techies in the world. And it's sort of the MediAssist and the promoter sort of gave me the freedom to very sort of easily navigate between tech, ops, and the product, and I ended up here.
Awesome. And Satish, MediAssist, the way it has operated, has been very different from other TPAs that were there or are there in the industry. What do you think has been the key differentiator between MediAssist and everyone else in this particular space, and that has led you to do things differently? I mean, you've grown faster than other companies. You've taken on companies like Raksha under your gamut. You also recently, took on Paramount. What has been the differentiator that has given you the growth that other companies could not experience as fast?
No, I think it's number one is our ability to put talent together. This was not an industry that most people looked at to join. Right? That's the honest truth 10 years ago.
Right.
So I was fortunate, and along with Dr. Vikram, we were able to attract an extremely diverse talent from multiple other industries and bring them into this business, right? The reason is this is a very young business, right? We are only 2 decades old as a licensed third-party administrator industry. So often enough, it's very hard to find talent within the industry, especially when you want to do something different. But we were able to convince a whole set of colleagues to come and join us in this journey. And a lot of the team still exists, right? If you look at the vintage of the management team. That was, in some ways, our number one reason, right? And then it's our collective belief that you need technology, right? You need to simplify and automate processes if you really want to scale the whole insurance industry and just not our business. And I think that's our undivided attention and focus on building tech, right? Is what sort of gave us the stepping stone for the growth, and of course coupled with some, we like to say, the reasonably prudent business choices that we've made in terms of the kind of business and the way we've run the business.
But do you still maintain that premise that getting people from outside the industry works really well? Or now that you have been there for last 2 decades, you believe that, okay, let's get more people who are from the industry now?
No, I think it's a mix of both, right? Because let's look at some industries like hospitality that have excelled in understanding customer service, empathy, right? And it's when you want to build empathy into your business, and then why would you not rely on the skill sets that are available, right? And there are multiple industries that have solved problems at scale. We are a young industry, so it's always a good mix of one, bringing people from the industry, bringing people from outside who bring the thought, but disrupting the current industry. But over the last 10 years, we've been able to internally grow a lot of talent, right? So if you look at our, at the levels of VPs, and we published list of all VPs on our websites, right? So many of them are now internally growing into the leadership roles.
Awesome. Satish, you were talking about technology being the key differentiator between what MediAssist has done or the difference it has created. So I'm going to now focus on the technology. What are some of the specific technologies and platforms that you have implemented to improve the processing efficiency and the accuracy within the system? Because that is where the challenge of the claim management is, and that is the administration part that you are handling as an organization. So what are the platforms and technologies that have helped you do that?
I think I'm just going to digress a little bit and take a step back. See, we are a sort of a downstream process in a patient life cycle of how they get paid for healthcare expenses, right? We're not the originator of the process. So we have other stakeholders who come ahead of us and the decisions that they take, the kind of data that they share is critical for us to get our process right. So there was a time, even today, the policy documents are unstructured, as in the sense they're English documents. Sometimes you don't get the structured data of the disclosures that you've made. You could have been a smoker, I'm already diabetic. Some of this information today is still in English, right, on the policy document. Hospitals today, for all the tech that they have inside the OTs, still give us scanned images of bills, right, and which is the starting point of the cost calculations, right? And historically, this industry was very heavy on movement of people and movement of paper. We still get lots of claims offline as paper today. We don't get all digital versions. So I think a lot of our efficiency was sort of built in layers. The first thing was to build trust in the system. And that's when our phase one of our tech went into how do I build real-time visibility into the same transaction for all stakeholders at the same time and in real time. So we did this as our first challenge in an industry that typically worked on a 24-hour lag. Then we used that to convince our stakeholders to remove people and paper movement and then move to integrations, right? We integrated with the hospitals, we integrated with insurers, we integrated with corporates, we integrated with everybody else, sort of became a middleware where we said, if I can get good quality access to the source data, it'll allow me to do a much better job, right, of servicing. Then from integrations, then we took this data and then said, how do I digitize at least workflows, if not data? And then that's when we took one step and then said, we're going to digitize our workflows. And so, for example, if the hospital submits a claim, can I instantly see it in my system without somebody having to interpret what the hospital has actually said? If insurer has issued a new policy, can I instantly get that into my system? If a corporate has onboarded a new employee, can I instantly know that an employee is onboarded and send them the welcome email and then get them their e-cards? So we did a lot of the workflow things first, right? And then, of course, for us to improve accuracy and consistency, the holy grail still is we don't get good quality digitized, or electronic data today, right? We still get unstructured documents from all sources, even today. Only the workflows have become electronic. The input data is still largely unstructured from other stakeholders. So then for the last 3-4 years, we've embarked on this whole digitization journey. So we do a lot of digitization at our side. We digitize bills that are coming from the hospitals. Today, with our investments in digitization over 5 years, we've reached a point where 65 to 70% of the scanned image bills that the hospitals send, we're able to digitize at a line item level, where we get to know that if a particular hospital says XYZ on the bill, I know if it's a doctor, it's a lab, it's a medicine, right? It's a, it's a consumable, whether it's medical, non-medical, payable, non-payable, which is what we are now plowing into, saying how do I improve my consistency of claims processing? Because claims is also an interpretation process, right, of the bill and the terms. And beginning to sort of use this data for AI. So that's been a little bit of a journey, Harbinder. I know it's not a straight answer to what you asked, but we haven't yet sort of, reached that holy grail where we say everything is, on the fly.
So, Satish, can you share with us some examples of how the technology and how you've explained what you are doing has resulted in reduced turnaround times for claims? Because something that the patients have always felt or be disturbed of is the time it takes to get an approval while the patient is awaiting the surgery. They don't have enough information about where is it stuck. Will the claim at the end of the day will be processed or not? Will they get the complete amount or not? All the things that you've spoken about technology, how has it helped in building that transparency? I remember you and me when we had met last, you had said, transparency is a key thing when it brings comfort. And we also spoke about, some areas where we've seen efficiency come in. For example, a traffic light. When we know that, okay, there are 15 seconds left, you are at ease. There is no anxiety, right? Similarly, in the claim processing, has this really worked, and how has technology built transparency? Also, you're dealing with a lot of data. So are you using blockchain to also process the data faster, ensuring accuracy? You said AI is now playing a very big role.
It's a multi-layered question, right? So, like I said, our fundamental starting point of building tech was to build transparency and improve trust in the ecosystem. So, as early as 2014, if my memory serves me right, we were among the first to have introduced real-time tracking of a claim, like you do on e-commerce and delivery today, right? And we ensured it was not just about tracking, right? The hospital needs to know that we are working on it. Insurer needs to know what's happening. The member needs to know what's happening. The agent or the broker needs to know that somebody is attending to it because they're getting calls. What we are doing, everybody else should see, right? So that was the whole basis of how we had built transparency. Even today, that's one of our strongest points, right? People actually, there is zero lag between one of my processors hitting a button and all stakeholders seeing what's actually happening to the claim. And that has always been our foundation for all decisions that we've made. It's transparency, and it sort of reflects in a lot of things we do. So today, for example, if you go to our website, we publish in real time the average time we are currently taking to process an admission or process a discharge. We actually published it in real time. Mm-hmm. And we tell you what's the average since midnight till now for admissions and discharges. We tell you what it was for the last 7 days, last 30 days, last 3 months. Have we gotten worse? Have we gotten better? In 10 minutes, 20 minutes, 30 minutes intervals. That's what we actually do to build transparency. It has allowed, I wouldn't sort of go as far as the new generation of technologies. I think a lot of efficiency is possible with simply the stakeholders working with each other electronically, and we don't need to solve more complex problems than that. But having said that, our admission averages today are probably about 22 minutes, and our discharge admissions turnaround times are about 44 minutes. But there is a catch. It is from the time we get the documents, all required documents. And there are two things that are still disrupting the customer experience, right? One, we not yet 100% cashless industry. So people first pay and reimburse. And often when you're filing a claim, you're not technically equipped to give all the documents in the first shot, right? And we ask for a bunch of documents, we ask for more clarifications. It is still a pain point. It is coming down to less than about 30% of our claims because most of it has moved to cashless. Second is, even in the cashless, today the hospitals still need 3 to 4 hours to produce a bill. Mm-hmm. As much as I'm bringing my turnaround time down to 40-45 minutes. So the real disruption that we are attempting to solve right now is how do I work with my hospital partners to eliminate the need for them to do that bill generation in real time, and actually on a basis of trust and prediction led by AI. Can I trust each other because we are partners for a very long time, and get to a point where we start to get patients discharged without waiting for the patient to passively observe a bill generation and processing process. So that's sort of where we are moving towards.
No, absolutely. I mean, I've seen that because the hospital probably is not as technically evolved yet to process the billing, because ideally, I mean, if a hotel can process a bill in a few minutes for everything that you have consumed in various part of the hotel, hospital also, I'm sure they're using automation when the medicine is being procured and sent to the OT or to the patient, the returns, etc. I think, so is there something that you're doing to help the hospitals build efficiency on their part so that it could help you?
I think we've tried to understand what actually happens, and I wouldn't necessarily put a blame there, but I think there's a fair bit of inefficiency, like you rightly said. There are multiple disparate departments and billing systems, and even though the hospital has all the billing items, often enough we have different kinds of contractual templates between us and the hospital. Often enough they also have to transform the raw costs into a contracting template, right? So I think there is an opportunity for somebody to solve that problem. I think what we are attempting to do is saying, listen, I usually know what you do if it's a knee replacement. Mm-hmm. I usually know how many days you have a patient. I usually know what goes into treating a patient, or the cost of the implants and the surgeries, how many hours you will spend in the OT. And we have broad-based contracts based on cause. So why do we need to convert a B2B process between me and the hospital to a B2B2C process where we are allowing the C to passively sort of watch this conversation happen, right? Is there some way using AI we can actually get to a predictability of what the out-of-pockets will be based on the policy terms and conditions with a fair bit of accuracy, so that the hospital, based on my word, you let the patient go, and I assure you of the accuracy of my estimates, and you take your time to generate the bill, give me all of the details that I need to adjudicate the claim, and I'm guaranteeing you that once I adjudicate the claim, I will still be within the ballpark of what I've actually estimated, right? So that's our approach to solving the problem rather than sort of trying to solve inside the hospital.
Got it. But tell me one thing, Satish, this brings me to a point, the anxiety of the patient is because their understanding of the insurance that they have bought versus the obligations that they have to fulfill to be able to benefit from that insurance, they have a very different kind of an understanding. For me, when I take a claim of, say, I take an insurance of, say, hypothetically 10 lakh rupees, I would assume I'll go to the hospital. If it is within that 10 lakh rupees, I'll get all the claim. And then they get stuck with that, हमसे ये तो बोला नहीं था आपने, ये इतने out of pocket expenses होंगे. Is there something that needs to be done to simplify the awareness, understanding of the insurance that people buy? Because typically the document has so many fine points which people don't even read, and if they read, they get very scared, right? So is there something that industry can do to educate the users without being fearful of getting an insurance done?
It's an interesting problem, Harbinder, that you bring up. It's a very complex process to buy health insurance, right? Not intentionally so. I mean, let's say you're buying car insurance or motorcycle insurance. Usually we all can sort of visualize a car that is involved in an accident, a flat tire, or the bonnet gone.
Right.
We have a sense of proportion of the damage because the overall value of the car is sort of fixed. And we're able to sort of visualize how much of cover we want based on how many years that we've already spent. We know it has a finite lifetime. But try being that person and then say, now your body is the car. Okay, I may have a hernia repair. I don't know how to think about it as a human being. Okay, I might need a stent in my heart. I don't know how to think about what is the cost, what is the complexity, what will it actually take. So we do a very poor job of understanding, anticipating our lifestyle, the needs and the costs of the treatment. And second, there was a time when you had a 3 lakh cover, 4 lakh cover was a lot. One, it's no longer adequate for the complexity of the diseases we are now seeing. Like, for example, cancer is the number one cause. Our portfolio, no matter how much you do, 4 lakhs, 5 lakhs cover is not going to be good enough for a sustained cancer treatment, right? So clearly, we are sort of underinsured. Even though we are insured, we are underinsured, right, significantly. If you look at our payout ratios, which is how much we pay for 100 rupees of claim, we will be globally, we'll be about 77, 78 within our portfolio. 77, 78% is what we pay. It's not that we're sitting here just deducting. Okay, there is a co-payment that you've signed up for to reduce the premiums. There are non-medical expenses like food, registration charges, billing, attendant, charges we don't pay for. And then there could be other conditions, right? Like, for example, I may have signed up to a plan that said for a hernia repair, I have a 60,000 rupee limit, even though my sum insured is 10 lakh rupees. But it is likely that in this particular case, maybe it was a 90,000 rupee bill or a 100,000 rupee bill. Then the gap becomes out of pocket. And now, to add to that, there are advances in the treatment, right? The modern treatments. I can do a regular appendicectomy. I can do a laparoscopic. Or tomorrow for gallstones, I can do a laser. I can do a bunch of other options, right? And each of these advanced treatments are more expensive than the traditional treatments. Often enough, we procure cover for the traditional care. And we actually want to use the advanced because it either gets me out of the hospital faster, allows me to heal faster, right? But then there's a massive gap between what you bought and what you are using that for. And absolutely, I wholeheartedly agree with you that a lot more can be done in educating people at the time of purchasing or renewing insurance policies. Having said that, since we don't influence that part of the process, one of the things where we've been able to use AI, interestingly, something that we haven't spoken about before, is we now show if you're planning an elective surgery, you can come to us and then tell us, I have an upcoming elective surgery. We sort of allow you to play with the hospital choice, room choice, and then estimate what will be your out of pocket based on those choices. Okay. So if you change a hospital, you'll see the out of pocket changing. You change a room type. Imagine your policy allows only a shared room, but you want to use a single room. And there's a proportionately that much more reduction in your claim. So now you can actually, and we not only just show a number based on contracts, we actually show a number based on what it would be if you were to convert that into a claim. And we also show you an explanation of what those out-of-pocket components are. Potentially, this is because of co-payment, non-medical, proportionate deduction, etc., etc. One of the things, very beautiful things that we've observed in the last 4 months is, of all the people who've used the intimation tool, about 50% of them downgraded their room choice at the time of filing a claim. Okay, so I'm then making a financially prudent choice. I'm not compromising on the treatment. Surgery is still the surgery, but I've chosen to use one room type lower so that the proportionate deductions don't apply and I actually get more of my costs covered by insurance. So I think what we are attempting to do is to tell people the value of planning, financial planning around the treatment, not just the medical planning.
Awesome. Let's get back to technology. You said you're using AI and you're potentially going to be using more of AI and blockchain, machine learning as and when, the more claims are processed, the system learns more. How has that led to, fraud detection, predictive analysis like you're talking of in terms of what is it that could be happening at the end of the, claim process? So has the system been foolproof, or have there been cases where the system, because it is a system-driven thing, that AI has made a mistake or kind of led to taking a wrong decision?
One of the challenges in building AI systems in this domain and in this is multifold. I mean, one is obviously the absence of good quality structured data that we can use to train the systems. That's where I said, like, we've been investing heavily in structuring data and then creating curated, good quality data sets for us to train. Our AI team is not built only of data science engineers. I have medical experts, claims experts, functional experts, field experts, fraud experts. So we don't actually have any AI solution that is deployed only by the data science team. So we don't do that, right? That was our first safety net that we had built. So even our simple mapping that XYZ on the bill, is it a medicine, is it a lab, typically goes through 3 different medicos agreeing to that mapping. We crowdsource through the process. If 3 people have agreed, and that's when sort of becomes actionable as a data set, for somebody else. So that was the first safety net that we'd built. And of course, it took us a fair number of iterations and fair number of models to get to a certain amount of quality. Like on fraud detection especially, we do work, and also on the predictive piece on the out-of-pocket, we do a lot of work. For example, on the fraud detection side, we have moved from about 20-25 crores a month run rate of savings of frauds being detected, about 65 to 70 crores a month being detected as fraud, simply because these were frauds that were not possible for human beings to find before, given the patterns and the lack of good quality data. So we've delivered in this H1, the ended September, 60% more savings back to insurers on account of finding frauds that were earlier not possible to be found. while that is value, we still operate in a model where the AI recommends and the human decides. We haven't yet flipped that model yet, right? Maybe there will be a day where you can trust the other way around.
Right.
But today we believe that given the uncertainty, given the empathy requirements that we bring into this business, what we are attempting to do is to help AI make the best quality decisions, but bring all of the decisions to the processor, the adjudicator, or the medico that was actually looking at it, and be able to agree, disagree, override, discard that decision. Right? One could argue, then why do you use AI and automation if you're going to bring human in the loop? I think it is today, that's our second safety net that we have, that we are not just shipping something without a human validation. Having said that, Harbinder, we have, depending on the process, between a 70 to a 90% concurrence of the AI's decision when the human being actually looks at it.
Right.
So that's the level of concurrence that we are currently running.
In cases where, there have been instances of a wrong decision being taken, do you feel that the cost of an error happening is less than trying to do it without using AI? Is there a cost benefit analysis that you've done where, because if there's an error that happens, it kind of puts a question on the efficiency of the TPA process in the minds of an insurance?
So I'll broadly split this into two types of process, right? One that causes or results in a cost to us. One that results in a cost to an external stakeholder, insurer or member, right? So the approach is not the same between the two. I think where it is a cost to us, clearly AI's false positives or false negatives are a hard problem, right? For example, I'm sampling for fraud. Okay, let's say I sampled 100 claims, but let's say only 10 of them are frauds and 90 of them are genuine, and my sampling efficiency is not good. I end up spending a lot of money investigating all of those claims, which is a very expensive process. So we do not today deploy until we reach a threshold that we're comfortable with, where I'm happy to run as many pilots in as many months and as many quarters it takes until we get to a point where the sampling or the recommendations of AI are more accurate than what we would do in our existing process today. That's when we completely flip to that model. And that is where in our fraud detection today, we are able to do far lesser work on the field, but find far more fraud using just the sampling.
Got it.
Right? So that's the cost benefit, but we don't let that impact our customer experience. But when it comes to a financial decision, which could potentially harm a member or an insurer today, we use AI to, like I said, make a recommendation, and I still have the ability for somebody to review that decision, right? Unless it's a very straight through cut, very simple, straight jacketed, right? You have a cataract limit of 30,000, you've done a cataract or surgery, hospital is billing 28,000, I have a package for 28,000, I know the patient is a senior citizen, has been in the system for a long time. Honestly, that is not something that requires human intervention, right? So we have enough cohorts that are super safe and almost like zero errors. That where we let the AI lead the cohorts.
Okay. And we all have been listening to this phrase that data is the new oil. And you coming from a technology background and working in a domain which is data heavy, are there any data analytics that you have used to provide insights, not just for your own business, but something that can be used by the insurers or the policy holders that could help in further decision making?
So, we are obviously custodians of somebody else's data. So all of the work that we do outside improving our operations and efficiency and accuracy is to work with each stakeholder and help them get a better insights, right? So we don't, it's not a separate business. It is the way we do our business to help improve the efficiency of each of our stakeholders. So insurers get near real-time insights onto how portfolios are performing. Today, every insurer can potentially see every claim I'm processing in real time and put a pause to it, take over, put it back into the system. So that's the level of real time one we built from a workflow perspective. Second, we sort of consolidate all of this data, give them insights like multi-year comparisons, how the portfolios are moving, what's actually leading the losses, what is actually changing the incidents, how is the behavior actually changing, and help them get better in understanding of the portfolios that they are underwriting, right? So that's something that we absolutely provide as part of our service offering today.
The success of a insurance model also depends on the interoperability between the hospital and the insurer, and that's the that's where you come in. Have you faced any issues related to interoperability, and what has been your approach to handling this to ensure seamless communication and data sharing? I mean, we began the conversation by saying that the reason you got into this space was to solve the problem related to fax documents coming in, the paper documents coming in, and now when you're putting the technology in place, the interpretation of how the doctor is prescribing, what has been your experience, and how is it changing today?
It's a bit of a mixed bag. Right? So, like you're aware, when I started this journey, we were dealing with faxes between hospitals and us. The discharge documents used to be, fax line was difficult to get, so the hospital would send all discharges in one shot in a fax, and then suddenly it'll spew out reams of paper. Believe it or not, I had a dedicated team that checked all the papers that were coming out and cut where it transitioned to the other patient. Right? And then we would rescan that paper at each patient level and give it to our processors who were elsewhere. And that's the kind of world that we've lived in not too long ago, about 11 years ago. So we did build our first of our exchanges to enable hospitals to sort of work with us. I came from a bus ticketing background where operators were very happy to integrate, right? I thought we would be able to integrate with every single hospital directly into their HIS, the system, and then pull out the records and then adjudicate claims, right? But clearly, after about spending a year and a half, it sort of didn't pan out as because the investments were not there on the other side. The technology was not as robust, not as real time. So we built this exchange where they could send us information, we could send them updates, and vice versa. Built it as a simple user interface, electronic workflow, but unstructured data. So that was the best we could find as a compromise. But eventually today, about 80+% of our hospitalization conversation are electronic, but from a workflow perspective. We as a country, we still haven't reached the point where the data is fully structured or, like the HL7 formats or FHIR formats, because we don't yet have electronic health records as a standard in the country. We don't yet have common billing codes, like the, let's say a CalPol can be written in 100 different ways, depending on the POS machines that you actually use for pharma. We don't yet write molecules, we still write brands on the prescription. So one has to sort of figure out all of that, right? So I think as a country, we're still a little far away from getting the data to be electronic. I think we've made lots of progress in workflows to be electronic, where we talk to each other in a system-to-system manner. With the government of India's the whole digital health mission, ABDM, Ayushman Bharat Digital Mission, it has multiple pillars. Hopefully, hospitals sort of adopting electronic health records over a period of time. And a common exchange where hospitals and payers can talk to each other through National Health Claims Exchange and HCX, where at least the envelopes are standardized, even the payloads are different, right? So at least it's like a super highway that everybody
Yeah.
can talk to each other. I think once these couple of things happen, the whole industry will sort of move to the level of electronic level at which we already are, right? So I think that's sort of where we are in that journey.
And Satish, you said you're a custodian of data that belongs to someone, right? That brings in a lot of responsibility as well in terms of protecting that data. The data which is most prone to being hacked or broken into is the financial data and then the insurance data, right? What, as an organization or the custodian of this data, are you doing to ensure cybersecurity, to ensure that the data is not compromised at any level, because it's a very sensitive data, not just to the insurer but to the patient as well. There's a lot of privacy issues that are there.
So that has always been a focus. So we run all of our engineering, data center, everything on our own, fairly anal about it. And we work with a lot of corporates today on the policy side. So we undergo a lot of audits before they allow us to integrate, securely with their intranets and single sign-ons. We undergo a fair number of audits by our insurer partners. We run our own assessments, third-party assessments, to make sure things are okay. And over years, we've also improved our whole secure development practices. Then we also engage with a lot of other external experts and partners to continuously tell us where we are. Of course, it's a massive amount of investment in tech, and it is, if not the reason, one of the main reasons why we like to be a profitable company. So we actually plow back a lot of our profits back into improving the business, right? And that's our focus. And I think that's, and there's nothing absolute in cybersecurity, right? But we make significant amount of investments in keeping the data secure and safe.
Satish, for you personally, what has been your biggest learning during this journey at MediAssist, which has led you to, because you're leading the organization, and you come from a tech background. Innovation is a part of your DNA, right? What are your learnings that have led you to the insights and create a culture of innovation within your teams that you're exploring or would be willing to invest in to stay ahead of everyone else using technology, because that's where your differentiation is?
I think a lot of that credit first goes to my board and the promoters. Very rare to find such talent in the board, and for a small company of our size, and with so much of experience and so much of forward thinking, that I think they've always pushed us to do something far beyond what is possible. And I think it starts from there, right? The culture absolutely starts with the board, because if the boards don't believe in what you're doing, then clearly, no matter what your intents are, you can never succeed. And we've been very fortunate to have both visionaries, experts, and execution experts on the board at all times. So it really helped us sort of, directionally sort of get an alignment and the constant support. And then, second, of course, is the team that you actually bring, right? Often we think tech is the end, but tech is just the means to the end.
Correct.
I think we are very cognizant as an organization that tech is not the end. We are not selling tech. We're a services company. We deliver services to people who are in distress, right? Of course, we charge a fee. But for us, the tech is what allows us to get out of the way and not compounding the misery of someone who's already in distress. So ironically, we like to be invisible. We don't actually like to be visible. Because if I'm visible, if you have to deal with me, even if I take a minute, I'm causing an extra minute or a media break in the way your service actually gets delivered. So a whole lot of our thinking along the way has been that how do I get out of the way? Whether it is self-help. So for example, one of the metrics that we publish today on our website is the number of support interactions that we actually get. We have over 9 lakhs of support interactions a month. But today about 40% of those support interactions are resolved by technology without a need for a human being. You can call the IVR will answer your questions. You can use the bots will answer the questions. We actually send out millions of SMSs, WhatsApp messages and emails to the customers in real time to say, here is where you are. Okay, we will tell you, like for example, I have received your pre-authorization request at 11:32 a.m. from this hospital. And you will hear from us no later than 1:32 p.m. today, right? So that's the anxiety, and then setting expectations, giving them that approach. It all looks like well planned when you look at it, when you look back. It's not only innovation, right? It is but the relentless focus every morning to say, how do I convert a reimbursement to cashless? So that one, you're not out of pocket and tracking, and how do I get out of the way? I think pretty much everything we do gets into that thing.
I think that's a brilliant thing, because that brings me to the cliche that we used to use a decade ago in technology, and we would say that technology has to be an enabler to a real problem, and that's exactly what you're talking of. That how do you get out of the way, and using technology, how can I make it quicker, better, efficient?
Absolutely, and just to do that, we also had to do a few other things, right? Because we had to go back to the source of the data, source of the problem, help them also get better. I'll give a simple example, right? Today, corporates have lots of employees, and we are an annual renewal business because the GI policies expire typically in 1 year. So every corporate is renewing every policy every year. So every employee then has to go back and re-enroll himself or herself and then say, here is my family, here are the people. You practically have to do this every single year. And the rates change. There are voluntary participations. You could choose to add your parents or remove them. You could choose to add a top-up or remove them. Interestingly enough, most corporates don't have today's systems to manage this. So one of the things that we do is to put a system there as part of our standard portal offerings to the corporates, where you can run your own enrollments every year at the beginning of the year, so that we collect good quality data that corporate can eventually hand over to the insurer, saying, here are the people I want you to cover. And then insurer can eventually give it back to us so that we don't have mistakes in the way we. So imagine you opted for a 10 lakh cover, but I don't know, I think you have a 3 lakh cover. Then there's a source for a grievance, right? So we do a whole lot of other things around this, which we don't actually have to do. But without having done that, we would never have gotten to the consistency that we've got.
Other than the technology, the other critical part of any business, and more so in your business, are the people. And you yourself said that that's the biggest asset that you really have, and that led you to be where you are today. Technology is changing, and you are responsible for changing it and making it better every time. How do you ensure that your people, or people in the whole ecosystem who make the process better, are trained, skilled, reskilled, upskilled continuously to ensure that the systems are used in a most efficient manner and the whole delivery process becomes seamless and quicker?
It's a tough problem, right? Especially in a very people-intensive services business in India, because they're distributed, they're across the country. We are in 90 plus cities in the country. And we are both the front end and the back end. We are not just a back office, right? Because we have account managers. Today on any given day, I would have 2,000 people out on the roads, meeting people, talking to customers, running field operations. So it's a bit of I think over the years we've perfected. We have internally councils that sort of curate all of these inbound feedback and the issues. So we have a customer council, we have a claims council. The customer counsel is led by our chief business officer, claims counsel is led by our chief claims officer, but both have cross-functional teams. The one counsel's job is to get all of these requirements, what is changing in the whole market, how are the products changing, how are the insurers' requirements changing, how do I sort of keep pace with it or get ahead of it from a claims and delivery perspective. And the customer counsel actually looks at saying, what are the customers saying, what are the new kinds of offerings, what do I need to change on my mobile, my app, my digital interfaces, my empathy, my communication, right? So now I think we've sort of organized that into the intake process, right, if you will. And these councils are sort of responsible for sort of creating a manageable list of changes that we will actually make to our internal processes. Then we have an extremely rigorous way of converting that into sprints in our tech. At our scale, we still deliver production updates every 2 weeks to every system that we operate. We have a 2-week sprint that we've never missed in these many years. So every week there is an improvement in the claim system, in the app, in the portal, in the interfaces, in the integrations, every single sprint.
Awesome.
And the sprints are then coordinated by the councils, the product, and the tech. And then now we're beginning to learn the value of change management because it's a large distributed organization. Then we've invested in our L&D teams. We now write down stuff. We actually do this for internal communication and train people and saying, here is a change that is actually coming up and here is why. I think that's the part of the process. It took us many years, but I think we are reasonably good in terms of the change management. I think the piece that we are now realizing is especially with the large size of the employees that we have and the integrations of multiple TPAs that we have done, we are now adding an additional focus on explaining the why part of it a lot more intensely, so that everybody sort of aligned to why we are doing what we are doing and not just get trained on what has changed, right? And I think that's sort of broadly our change management philosophy.
And extending this, I mean, you used a part of what you just said to explain it, but if you can just categorically explain what are the KPIs or the metrics that demonstrate the impact of technology in operational efficiency in your business?
So it varies by the stakeholder, right? Clearly, we have lots of stakeholders. So insurer looks at inflation of average claim size year on year. How are we managing medical inflation? How is my network expansion? What am I doing on fraud, waste, and abuse? What am I doing on customer grievances, retention? So those are the kind of metrics that the insurer looks at us, right? And turnaround times, SLAs, etc. Then the hospitals are looking at us while there are no KPIs and saying, hey, I've given you credit. How soon am I getting paid? What are my disallowances? Are you sticking to your promise of what you said you will pay by the time you actually pay? Are there any unreasonable deductions? Am I actually benefiting by being on your network? Am I getting a fair price for what I'm delivering? And is my cash flows in line with the credit business, right? Those sort of become the KPIs for the network. And of course, then we have the agents who do this, feet on street retail. Often enough, the agents operate in cities and areas where the customers solely rely on agents, right? And for communication, for understanding. How do I keep the agents in the loop? How do I enable self-help for the agents? Can agents act on behalf of the retail policy holders, that are there? And then, of course, from our own perspective, right? Internally, what are my unit costs, right? Am I actually doing better and better on eliminating a process rather than just holding on to something? Often cost is a reflection of bad customer experience. We all think cost is often a reflection of your own internal inefficiency. But if you actually change your mindset and looked at it from saying same thing as your lean and everything else, right? So you look at what am I doing that the customer doesn't value, right? Then often enough you keep finding over a period of time, every organization, there are processes that you've set up with the right intent, but over a period of time they run because they're running, right? So I think we do this constant reassessment internally and saying, is this really needed because it's adding another 2 minutes to the customer or 3 minutes to the customer? That is how Our KPIs include even our own turnaround times, and that's how our admissions are down to a 22 minutes average, and discharges are down to a 44 minutes average.
Brilliant, brilliant. Satish, you guys recently brought out a report on the the borderless health and insurance for all by 2047. What is your vision for borderless health and insurance for everyone?
The government of India, of course, and has said that by 2047 we want insurance for all. So we obviously, within the health insurance that we operate in, we're hoping that by then everybody would have health insurance, right, for all. But the borderless is more about letting people have access to healthcare, affordable healthcare, wherever they are, in whatever format that they actually want to access in. But there is no one solution that fits all sizes in this country. We are almost a continent, right? We're just not a country. We are. So if you looked at sort of stratified the country as an affluent or a middle or aspiring, India, upcoming India. So there, different segments have different kinds of health covers and different kinds of opportunities that exist in cover. The affluent category, which is probably, let's say, anybody who owns more than 5 lakhs, maybe there's a 20% of India, where maybe 3/4 of them have some kind of a health cover because they can afford it today. Either employer is providing it or I'm buying it myself. Then there is the bottom, that's about 50-55% of India. About 70% of that is also covered through Ayushman Bharat or Pradhan Mantri Jan Arogya Yojana, some of the state-specific schemes where people who can't afford healthcare, at least there is an opportunity for them to get some cover. There is still a 25% of India which is neither rich enough to get healthcare on their own or not part of the formal or organized sector to get employer-sponsored benefits, and not poor enough to get the support from the country. And there the penetration is exceptionally low in the missing middle. So what we are saying is we need horses for courses. We need different strategies for different strata.
Yes.
And within each segment, again, there are 3 kinds, right? There's a G2C, which is government to consumer. There's an E2E, employer to employee, or E2C, and then you have the B2C where you're directly buying. So we're going to have to slice and dice this country, population, and into cohorts, and say what cohort actually works best for which kind of a population. And really, to deliver this, we believe that there's a trinity of jam, like you had the jam in fintech, right? When the government came up with the financial inclusion side, believe there's an equivalent of a jam, in to make this happen, which is J is for joint health data. How do I bring all of this data unstructured, like electronic health records, policy data, your personal health records, longitudinal health records, vaccination records? Where are you from a data perspective? Then automation on top of it, on underwriting, fraud, processing of claims, right? All of those. And then use mobile to actually deliver healthcare where you are, right? Today, often enough, there are multiple intermediaries involved in you and finding your healthcare, right? Can healthcare come to you? Do you have immediate access? Do you understand how to navigate yourself into the right kind of the care paradigm? So that's the jam trinity, right? So we're hoping that by investing collectively as an industry and a country into these capabilities and identifying the cohorts and enabling the right kind of, like for example, today I may have a package. Today the packages of costs are between the institutions, right? Between the payers and the providers. Why can't Harbinder design his own packages based on what is your health status, what are your personal needs, what is your family? How do we actually get to a personal package for each citizen? Because only then healthcare will make sense, right? Because what works for me does not work for you. Right? So that's sort of the overall theme of what we have put together as the borderless health, and we intend to do this year on year, bring all the industry leaders to facilitate conversations, and then really strive for action.
Awesome. And We are just heading for a budget. As a TPA, what is your expectation from the government? What needs to happen, and what is it that you're expecting as an outcome of the budget that is just around the corner?
This is an annual question. So, I think it's less about as a TPA. I think our fortunes or everybody's fortunes are very intertwined with how the health insurance industry grows.
Correct.
So I think there've been standard asks for some time, which is the whole 18% GST on the health insurance.
Yes.
Clearly, it's a significant amount of expense on something as critical as health insurance. Today, for example, even an employer, when they purchase group insurance cover, right, it's not even input credit that you can actually take on the expense. So even simple things like reducing some of the tax burdens will go a long way, in our opinion, in improving the cover. And the second thing is that, like going back to our borderless vision, we believe that some of the corporate world can also play a role in adjacencies into other areas. Right? Today, for example, we all spend money on CSR, 2% of our average profits for the previous 3 years. But at the same time, can I find a way to take ownership for the missing middle or the people who can't afford health insurance? Is there something that we can actually participate in, right? And then actually contribute in a meaningful manner. So we all contribute to ESIC. We all contribute to multiple other government schemes today. Is there a way for some of that also to plow back into some of the other adjacencies, right? Where, for example, if we are contributing to ESIC and the consumption is lower than what we are contributing, can that sort of come back into an Ayushman Bharat, or come back into providing some additional cover for unorganized sector and so on, right? Because today ESIC requires you to be part of the formal employment structure. But maybe we are contributing, but we are able to afford other forms of healthcare to our employees. Can I sort of reuse some of that into plowing for the unorganized sector, right? Your employment could be unorganized, but your healthcare could still be organized.
MediAssist today is a reasonably big sized organization. You have 6,500 people spread across 90 cities, you were saying. Everybody in the organization has their own personal vision about themselves, their own wish list of what they want to do for themselves, for the company, for their family. And there's a typical vision and a mission statement every company has. But at the end of the day, it boils down to what is it that we do, how we do it, and why are we doing what we are doing. As a business leader, how do you keep pace with keeping the company aligned to why that you have in your mind, so that there's no stress around trying to do a business in the manner that it should be done?
No, I think I personally find conversations as the most important way of getting that done. I think we spend a lot of time talking to each other. Like we have a culture where we don't make a change as management unless we write it down and send it to an extended group that we have created of my direct reports, some of their direct reports, nearly 40 of us. There is no change that happens in the organization unless the 40 of that group is actually told first and had an option to sort of opine.
Okay.
Because they bring various inputs from various parts of the country. These are functional leaders, regional leaders, business leaders. But we've got a group of 40, that's the current and the future leadership of MediAssist, that we make sure, like I don't ask for a change if I have not written it down and I have not posted that on that group, ever.
Okay.
Right? And second, of course, is I think solving for 20, 30, 40 is still easy. I think the challenge is how do you sort of take this back to 90 cities and so many different, and I think we use the traditional models like internal communications, blasts of communication, town halls, virtual meetings. But of late, the thing that we are realizing, and it's a very unconventional format, is at least we're getting the top 400 now from the 40, and then say, how do I have a more intense, personal, freewheeling conversation? What's actually going on, right, in the company? What are we doing? What's happening in the market? How should we react? Why are we doing what we are doing? Because often, even though the 40 know the why, the remaining 6,500 just know the what and the how.
Correct.
So I think that's now we are attempting to go down and then say, how do I talk to the next 10x of the group, get them into a room and then give them an absolute freedom to ask anything, talk anything, and get answers to anything, of course in a closed room, right, for obvious reasons, but that's what we are doing.
We were talking or having a conversation before we started this formal conversation, and you were talking about why. You know, what is the importance of understanding the why and aligning everybody else to your understanding of the why, or to any leader's understanding of the why?
No, it's just whether your heart is in sync with your mind, right? I mean, often we build corporate cultures where instructions are carried out without questions. Often the decisions are made far away from the field. And we have very poor two-way communication structures in most organizations where people taking decisions don't necessarily have a pulse of what really happens in the last mile, right? And many great corporations and leaders have solved these problems very well. But I think, for us, what we're attempting to do is to, when we have these conversations, one, we know why we are taking the decision as leaders in the first place, so that we're able to explain to people whose life actually gets impacted. I could make a system change tomorrow. I could change the way the status is presented to the customer. But my customer support team doesn't understand why we are making this change, because other than just replicating what we've asked them to do. But the fact that you're able to sit there and then say, hey, this is what has changed in the regulation, this is what has changed in the insurance process. Or when we were doing the thing earlier, the customers still had unresolved questions because we were not able to go into the next level of detail, and that is why we are doing. Like, I'll give you a simple example. Today, we process claims on behalf of insurers, and we ship our recommendation to the insurer. Insurer automatically or manually consents, right, to the recommendation, and then that becomes an approval of the decision, right? Then it goes to the customer. Right, the policyholder. Let's say the policyholder disagrees with something for whatever reason, right? It could be that I still have to give a document. You should have asked me. I gave you the document, but you didn't consider it. Or, hey, I've been covered for longer than you think I am. It should not have been deducted. Or it could just be that it was an emergency. My doctor gave me a letter, but you guys are not treating it as emergency. It could be like a million reasons why the customer could potentially disagree with the outcome. So one of the things that, so of course that results in customer support, inbound, right? So customers calling, asking why are these deductions, and then there's a volume of calls that result in, and then we have a process by which we explain the deductions and occasionally a reconsideration. So we've now made a change where we're saying, before we finalize the decision, we will take our provisional decision with full transparency and details, give it to the policyholder and say, here is what I am going to finalize. And if there is something that you want to tell us now, rather than me taking a decision and then you having to sort of fight the decision. And it sounds simple, it's a very complex change from an organization perspective, because sometimes our teams will come back and then say, hey, listen, instead of getting 30 calls for 100 claims, I'll now get 100 calls for 100 claims. It's a fair, fear, right? Then account managers are worried, right? What happens if there's too much of backlash? What happens if we get too much of dissatisfaction? At some point, you have to sit people down and then say, listen, at the end of the day, your error percentage is not changing just because of when you're communicating. If you really want to show empathy to the customers, we will take this head on and then ask, at least we know the universe of errors that we're dealing with. Then you can actually go back and change your processes, improve your processes. It's not like you're going to process claims worse just because you're talking to the patients earlier, right? So it's interesting, right? When we actually sat down, looked at all the metrics, looked at the numbers, looked at the reasons for customer dissatisfaction, then it becomes more and more obvious that you're just doing the work that you used to do later, much earlier, but it is the right thing to do with the customers. And our disagreement percentages are lower single digits still.
My last question to you, and I'm very tempted to ask you this question. I mean, the journalist in me kind of is pushing me to ask you this question. And this is around the recent conversations that have been happening around the approvals of Saif Ali Khan's claim approval. You know, when the claim of 36 lakh rupees bill was presented and within a few hours 25 or 26 lakhs got approved, there has been a lot of backlash in social media on the disparity of the customers being treated based on the societal status. In some conversations, the role of TPA has also come up. What do you have to say about this situation? I mean, what is your perspective about this situation that has been there?
Interesting questions, Harbinder, but I don't want to comment on any specific individual's medical condition or a policy, right? But I think broadly I'm taking the themes that are common for the work that we do. I think first and foremost thing that concerns me in this is we have no value for privacy of an individual's medical records or financial records, right? That's what bothers me the most in this case, more than anything else.
Absolutely.
The fact that somebody's private information, the claim approvals, the values can be public domain is a little disconcerting, right? Which I think we need very strong safeguards at our provider side, insurer side, and all of us. And I think it's the number one takeaway for me, right? The second, of course, is that if given the pain that is typically associated, at least from a perception perspective around health insurance, like you've seen what happened in the US with the UHC CEOs and the social media reactions, and it's worrying, right?
Yes.
Because the kind of perception that builds out on the 3Ds of the delay, deny, deduct, models of the health insurance.
Absolutely.
But at the end of the day, even if all of these rumors were true, I would say even there, somebody didn't get 100%. Okay, so then clearly adequacy of cover seems like an issue across the board, and it is not limited to a common man, right? I mean, nobody said we've got 110% cover or 110% payout. So I think that's the second takeaway, right? We don't know what life is going to throw at us. I think as a country, especially those that are educated, are employed, or have money, I think we all need to learn how to size our cover, get the right kind of adequacy, built into our plans. And maybe the health insurance products need to evolve to really cover things that are beyond our control, right? And I think that's where a whole lot of product innovation, the emergency care, catastrophic care sort of needs to come in. And third is I don't think any insurance company or a TPA today works on the principle, and I can speak for all, that if you're a rich customer, you get faster, and if you're a poor customer, you get slower. We are all regulated by the same regulator who has the same level of SLAs for all of us. I get asked on every claim that is beyond the stipulated SLA. It doesn't matter who the policyholder is, who the owner is. And I think that I must compliment the regulator, and especially with the recent guidelines in health insurance, the master circulars. For the first time, the regulator actually said that it is the framework, here are the SLAs, here are your obligations, here is how I will penalize you in case you miss your obligations. And all of us today, it's an extremely tall order to achieve everything that the regulator today wants us to. But the entire industry today is switching gears, providing transparency, and I think some of these things hopefully will be things of the past pretty soon.
Thank you so much, Satish. That's Satish Gidugu, for you, some of the things that actually came out of the conversation, if I understand correctly, Satish, is that at the end of the day, we as a business are working towards creating a customer delight. And the customer delight in our business that we're talking of is related to efficiency and transparency that leads to predictability. Because if there is a predictability of what could come up in terms of a claim process, it just creates a certain level of comfort while using the policy that you bought for the reason that you bought it. And while you were talking about AI and using blockchain and newer technologies and the role of human beings alongside that, brought me to a point that we are in the business where the head and the heart need to work together, because the objective outcome created by the AI or the machine has to be validated by the emotions that the industry is expected to have at the underlying level. Last but not the least, what was very, very heartening to understand specifically for MediAssist was when you spoke about your board. Because when the intent is there, it gives you the opportunity and the comfort to do what can be really meaningful for creating the outcomes that you really wish to do. And over a period of time, when people are allowed to work on creating efficiencies, it creates a culture of innovation within the organization at all levels. So that's a brilliant job done, Satish. Thank you so much for taking out time to speak with us at BW Healthcare World. Thank you so much for being a part of Thursday Thought Leaders with Harbinder Narula.
Thank you so much, Harbinder. It's a pleasure to be here, and I feel privileged that you've chosen to talk to me today. Thank you.
Thank you.
Thank you.